This is Caring for Kids on News Talk 760 WJR, presented by the Children's Hospital of Michigan Foundation. And here's your host, President and CEO of the Children's Hospital of Michigan Foundation, Larry Burns.
Thanks, Mark, and hello, everyone, and welcome to Caring for Kids. We've got a great show planned tonight discussing the important topic of mental health and wellness, and how the work being done in this area is impacting children locally, regionally, and nationally. Tonight we'll be joined by Dr. Daniel Eisenberg, Professor of Health Management and Policy at the University of Michigan, Dr. Jean Twenge, Professor of Psychology at San Diego State University, and Kalass Chief Executive Officer at Starfish Family Services, and Lisa Nuszkowski, Founder and Executive Director of MOGO. It's all coming up next on Caring for Kids here on the great voice of the Great Lakes, News Talk 760 WJR.
It's Caring for Kids with Larry Burns.
Dr. Daniel Eisenberg is a professor at the University of Michigan for Health Management and Policy in the School of Public Health. Dr. Eisenberg is a faculty member at the Population Studies Center and the Comprehensive Depression Center, both of which are also located at U of M. His goal is to improve the understanding of how to invest effectively in the mental health of young people, particularly in college students. Dr. Eisenberg is also the director of the Healthy Minds Network. He completed his bachelor's degree and PhD in economics at Stanford University and a postdoctoral traineeship in mental health services and policy research at UC Berkeley. Dr. Eisenberg, welcome to Caring for Kids.
Thanks for having me.
Appreciate it, and I know that you're a very busy man traveling the world, so stopping by to talk to us about this important topic. One of the things our foundation, Children's Hospital of Michigan Foundation, has recently adopted is focus areas for our funding into the future, and mental health is right at the top of the list. And so we're trying to do as much as we can in that capacity. And I'm wondering if we could start out by asking you to tell us some of the work you're doing, and then maybe leading into the role at the Healthy Minds Network.
So my work is focused on youth mental health, and a lot of it is focused more specifically on college student mental health, college population mental health. And as you mentioned, I'm based in the School of Public Health, and so the approach to mental health is very much a kind of population-level public health approach, where we're interested in how our entire populations of students doing. We want to kind of go beyond just looking at medical care or health services, but also kind of more preventive ideas, or kind of people who might not be making it in for healthcare services. How are they doing? What are the factors that might explain why people receive services or not? And so our main study over the years is the Healthy Minds study, and it's a national web-based survey of college student mental health issues and service use. But I'm also actually just now starting a book project that will kind of broaden my perspective and look at children's and youth mental health more generally, and also kind of get back to my roots in economics by looking at the question of what are the best investments in children's and youth mental health as a society.
I spent 27 years in higher ed, mostly at the University of Toledo, and this is such a major issue for youngsters coming into school and being alone and being on their own for the first time. And I understand that you're also working with a nationally recognized foundation, JED Foundation. We've actually had some folks from the JED Foundation on this show, and their new initiative on college campuses. And we, the foundation, are going to be involved in that in some capacity. And so I'm wondering if you could share with our listeners more about that program and what you hope to accomplish.
Yeah, we're really excited about our partnership with the JED Foundation and their JED campus program. So what they've been doing for the past few years is working with college and university campuses to assess how their mental health services and systems are doing, kind of what are the strengths and weaknesses, and where can they improve, and then kind of putting in a strategic plan into place for making some improvements based on the campus's situation and needs. And they wanted to partner with us and vice versa because they've been working closely with administrators and kind of getting information from administrators, but they also want to have a student perspective on how things are going on campuses, what are kind of the areas of need, and also what kind of progress are these campuses making. And so our survey of college student populations kind of fits naturally as a source of data to assess the campuses kind of pre and post, baseline, and sort of after they made some changes to see if things are working.
Excellent. I believe there's 13 colleges and universities involved in this study, as I remember, hopefully correctly.
Yeah, in Michigan, I believe.
In Michigan,
that's the number. Yeah, there's many more nationwide, too.
Because of social media and technology and the ease of, unfortunately, bullying, is this something that's things have changed over time that college kids have to face that maybe when I went to school in the 70s that didn't have to deal with?
Yeah, I mean, I think the bullying and the online kind of online bullying in particular is something I think we still hear more about it at younger ages, middle school and elementary. But I think, middle school and high school, but and even elementary. But I think what's definitely true for college populations is that online media and social media in particular are clearly a powerful force, and for both good and bad. And so, for example, many people have heard about research looking at, I believe, college students and their use of Facebook and feeling depressed after viewing Facebook. And so that there's examples where it seems like maybe social media can actually be harmful to mood or to mental health, but at the same time, there are lots of great resources that are online and more every year. So we see that as really an opportunity. Like, how can we take the best of social media and kind of online resources for college populations? So
I know that for this show and WJR, 50,000 watts going across the Midwest, there's an awful lot of parents and grandparents who listen. And can you give us some pointers or some thoughts about mental health and adolescents and young adults that we should be aware of, or maybe some telltale signs that if we have a college student that maybe there's an issue that shouldn't be ignored?
Yeah, with the caveat that I'm an economist and not a clinician.
Right.
You wouldn't want me being your therapist, right. but yeah, certainly some of the telltale signs to be looking for that I think are fairly well known in the mental health field are particularly if there's significant changes in behavior, if a young person is becoming more withdrawn, or their appetite changes significantly, or they're having more problems than usual with sleep, or just kind of no longer enjoying some of the same activities that they normally enjoy. So those are some of the telltale signs of depression in particular, which is one of the most common issues, mental health issues for young adults. And of course, there are other issues such as anxiety and eating disorders that to be mindful of. But I think a strength of this generation of young people is that more than ever, they're familiar with mental health services, and I think they're more generally comfortable and open with the idea. It's not to say that every young person is automatically prepared to seek help when needed, but I think there's more openness in the culture in general, and I think that's a strength that we can leverage when we look to support our young people.
Absolutely, and I think that's a very good thing. And thank you for being on the show as you, I know you're traveling, and I look forward to hopefully meeting you in person as our foundation of the Children's Hospital of Michigan Foundation gets involved with the JET initiative along with the Flynn Foundation right here in Detroit and others. So I look forward to continuing our discussion.
That sounds great. Thank you.
Appreciate it very much. That was Dr. Daniel Eisenberg, Professor of Health Management and Policy at the University of Michigan. And coming up next on Caring for Kids, we'll hear from Dr. Jean Twenge from San Diego State University when we continue here on the great voice of the Great Lakes, News Talk 760 WJR.
Welcome back to Caring for Kids on WJR, presented by the Children's Hospital of Michigan Foundation.
Dr. Jean Twenge is the author of iGen, Why Today's Super-Connected Kids Are Growing Up Less Rebellious, More Tolerant, Less Happy, and Completely Unprepared for Adulthood. She's professor of psychology at San Diego State University. Dr. Twenge, welcome to Caring for Kids.
Thank you so much.
We appreciate it, and I happened to see a review of your book in the Wall Street Journal and also some other things, so I said we got to get Dr. Twenge on our show, particularly this month, as we concentrate a bit on mental health and some issues. So why did you decide to write a book about this generations and the children? It'd be interesting to hear that.
Yeah, so I have been looking at generational differences for about 25 years, and I mostly look at these really big national surveys of teens that have been done since the 1970s. And right around 2012, I started to notice some kind of sudden changes in the way teens spent their time, and particularly in their mental health. So loneliness started to spike upward. More teens started to say that they felt useless and that they felt like they couldn't do anything right, which are classic symptoms of depression. So I kind of realized there's a pronounced break here between those born in the 80s and early 90s, usually known as millennials, and those born after the mid-1990s, who I call iGen.
Okay. After the mid-90s.
About 1995.
Okay. So you talked a little bit about who belongs in the iGen and kind of what makes them unique, maybe in a little bit more detail versus the millennial group.
Yeah, well, these mental health shifts are, among the biggest changes, but there's also been a really big shift in the way teens spend their leisure time. So iGen teens, for example, compared to millennials and Gen Xers before them, spend less time hanging out with their friends in person. They spend less time doing pretty much anything that teens usually do when they get together with their friends, like going to the mall, driving around in a car, going to parties. And so they're just getting much less face-to-face interaction, and that's probably because they're spending much more time communicating with their friends through social media and texting.
Indeed. And, and I often say that when I grew up, if I had to have the courage to ask a girl out somewhere, I had to actually call her and get the courage to do that. And in today's world, they just text people and so do you see that interaction or the lack of having to have that interpersonal connection? Have you seen any results of that in the work that you've done?
Yeah, so my best guess is that the increase in mental health issues that started around 2012, that the most likely cause of that is the rise of the smartphone and the amount of time that people spend on their phones and on social media and so on. 2012 happens to be the year when the percentage of Americans with a smartphone crossed 50%. That's exactly when these mental health issues started showing up. Teens who spend more time on social media, on texting, on gaming, just on screens in general, are more likely to say that they're unhappy and depressed. Not the teens who don't do those things at all, because then there's usually other issues and they're completely disconnected.
Right.
But beyond about 2 hours a day or so, and for most teens, they're spending a lot more time than that on these activities. This has been the biggest change by far in teens' lives between, say, 2012 and 2015, just a very brief period. That's when this smartphone really, really caught on, and that's also exactly when these mental health issues started to show up.
We're talking with Dr. Jean Twenge, who is a professor of psychology at San Diego State University. So this show has a lot of parents and grandparents who listen on WJR and flagship station in Detroit. And so do you have any both advice and also some telltale signs that parents, grandparents should be looking for with their child that may concern them?
As I mentioned, especially for older teens, the key isn't, taking away that smartphone entirely. That's how they communicate with their friends. But that use beyond about 2 hours a day does seem to be problematic. So the great news is there's an app for that. You can put an app on your teen's phone that, say, limits, for example, the amount of time they spend on a certain social media application, or that shuts down the phone at night, because that's another really key thing for mental health and happiness, is to get enough sleep, and a lot of teens are taking their phones to bed with them. For younger children and teens, I think we have to have a serious conversation about what's the best time for them to be getting their own smartphone. The average age now in the U.S. is 10.
10.
And that's, I think, way too young. They're not emotionally ready to handle that level of electronic communication, especially if it ends up crowding out face-to-face interaction. Plus, the mental health effects seem to be the largest for the younger teens. So waiting until, say, high school might be a better idea. And if you feel like your child needs a phone for safety, there's flip phones and there's wristbands and there's other solutions other than giving them complete, full, unfettered access to a smartphone.
Do you see any correlations between the mental health as it relates to maybe children using their phones to bully other children?
Yeah, so that's a bullying, both in-person and cyberbullying, is obviously a huge risk factor for suicide among teens.
Right.
But even apart from bullying, there's a link between teens spending an excessive amount of time on their phones and the number who have risk factors for suicide, like feeling sad and hopeless for 2 weeks or thinking about suicide or contemplating suicide. The teens who spend 5 or more hours a day on screens, for example, are twice as likely to have one of those risk factors as those who spend an hour a day. This is something I think we really have to have a conversation about, that we've seen an enormous increase in the suicide rate among teens,
right,
or at around the same time since 2010. It's, for some groups, it's really large. For teen girls ages 12 to 14, the suicide rate has tripled. Wow. And that's the population often that already has a smartphone, even though they're very young. Girls are on social media more than boys are. Mm-hmm. And this, I think, is the population we really have to worry about because, thankfully, it's such a rare outcome, but it's such a horribly tragic one.
Absolutely. And so I mentioned our foundation that we're becoming more proactive about our funding priorities. And just based on what you know and what you see, do you have any advice to me at the foundation about the things we should try to fund to try to help this mental health issue in children?
Well, I don't know if you fund research, but it'd be wonderful to have better research on the effects of smartphones and exactly why they're seem to be having these mental health effects, and some great controlled trials. With that would be great, because we're getting closer to seeing this connection, but we could certainly use better research evidence, and just an education program for both parents and teens. That I think there's a common perception, teens are just spending time on their phones because they're communicating with their friends. Teens have always done that. No big deal.
Right.
But that assumes that electronic communication is just as good for mental health as them hanging out with their friends in person.
Right.
And it's not.
No.
It's not as good. That's very clear. Some of them are telling us that they're really suffering, and we really need to pay attention to that.
Great advice. Thank you very much. Appreciate it, and hope we talk again in the future.
All right. Thank you so much.
Thank you very much. That was Dr. Jean Twenge, author of iGen, and also a professor of psychology at San Diego State University. And when we come back, we're going to hear from Ann Kalass from Starfish Family Services when Caring for Kids continues here on the great voice of the Great Lakes, News Talk 760 WJR.
Welcome back to Caring for Kids on WJR, presented by the Children's Hospital of Michigan Foundation. Once again, here's Larry Burns.
Ann Kalass is Chief Executive Officer of Starfish Family Services, an organization whose mission is strengthening families to create brighter futures for children. Her passion and drive come from the belief that all children can and should realize their full potential when supported by positive, healthy adult relationships and quality educational opportunities. I couldn't say it any better than that. Over the last decade, Ann has driven the organization's strategic growth and impact by better connecting Starfish services to families and communities across Wayne County. In 2014, Ann was elected to the Northville Public School Board. She received her Bachelor of Arts degree from the University of Pennsylvania, MBA from the Tuck School of Dartmouth College, and a certificate from Harvard Business School, Strategic Perspectives on Nonprofit Leadership Program. That is very impressive. So, Ann, welcome to Caring for Kids.
Thank you, Larry. I'm really glad to be here.
Great to see you. And Since I've been back in Detroit and in the job at Children's Hospital Michigan Foundation, you and I have met several times.
Yep.
Went to your great fundraiser and raised a lot of money for Starfish. And so we hope to do some things with our foundation and Starfish in the future. But maybe we should start out by letting our listeners know about Starfish Family Services and sort of give them an overview of that.
Okay, great. Well, again, thank you. And for more than 50 years, Starfish has been in the Detroit area, helping thousands and thousands of kids realize their full potential, despite lots of barriers and challenges they may face within their families or within their communities. Some of these kids are living in poverty or maybe dealing with family dysfunction that can often relate to mental health challenges. While we've been around a long time, we've evolved over the years in how we work with children, and it's really for the last 20 years that we've brought an investment and prevention mindset to our work, really moving upstream and trying to connect when we can with young children and young families to help them stay together and thrive. And we really recognize more and more every day the context of family. Kids live in families, and we need to work at both of those levels. So what that looks like day to day around Starfish is that we have a large early childhood program. We've got a couple thousand children, 0 to 5, from families with limited resources that are in our early childhood centers across Wayne County. And we also have a full mental health program for children and families because many of the families that we're working with have mental health challenges either at the parent or the child level. And lastly, we have a range of parenting and youth programs that looks like parent education, parent enrichment, financial literacy, life skills training. For the caregivers that have the most impact on our children, and that's parents and future parents.
Great. Well, and as you and I have talked in the past, and we're talking with Ann Kalass, Chief Executive Officer at Starfish Family Services. You and I have chatted in the past, but our listeners might not know that our foundation, Children's Hospital Michigan Foundation, now has 5 focus funding areas.
Right.
And 4 of those are preventative. The major 2 basically that are not preventative are research in cancer and cardiology. But the others are pretty much trying to prevent children from being in a hospital or being at risk. And what you just mentioned about Starfish sort of connects all of those. And so tell us a little bit about what Starfish sees if you're working with a family and they have some wellness issues and maybe nutritional issues that could possibly lead to mental health issues. I mean, do you see how it's interconnected with one another, how this happens in families?
Yeah, absolutely. And I think one path into answering your question is really just to talk about stress and the cumulative impact on stress for children, sometimes known as toxic stress or adverse childhood experiences that you talked about, nutrition. So if a child is in a home and they're stressed all the time because they're wondering where their next meal is going to come from, or they're in a home with regular physical abuse or emotional abuse, or they're in a neighborhood where when the sun goes down, bullets are flying, or there's a sense of lack of physical security. That accumulation of factors within a family, within a home, really impacts our children in an adverse way. And we are working at Starfish across all of our programs, whether you're a mental health professional, you're a teacher, you're an administrator like I am, to understand what trauma looks like, to get away in our work as an organization and then with parents from labeling children as bad to understanding that when children act in a way that we might not approve of, it's an expression of something that is wrong in that child's emotional well-being. And so how do we recognize that and build skills and capacity in our organization and for parents to help children weather through those bad emotions and get to a better place?
Well, that's important because I happen to believe that our foundation over time can save a lot of lives by doing exactly what you suggested. And I first became kind of aware of that when I was in higher ed, when you dealt with behavior of college students. And there's a reason why people do the things they do. There's a reason why people don't trust one another. There's a reason why. And I think what you're saying is that you're really trying to get to the root of why kids, they're not just bad kids, there's something going on in their life that causes them to have this behavior.
Absolutely. And another piece of our work, and I think it's a place that you and I are already talking and having conversations, is when we have children that are struggling with emotional challenges or mental health challenges, how do we link them to supportive adults and to programs that are designed to help them get to the other side in a healthy way and live a long, healthy life? And there are issues of access to mental health programs that Starfish is working on every day. Children who have a stomach ache because they're stressed out because something has happened in their family or they're being bullied at school. That stress shows up in a pediatrician's office for a stomach ache, or it shows up in the principal's office because that kid has acted out because they don't feel good.
Right.
And so we are working at Starfish with partners like you of how do we move those services to the places where children live their lives, in schools, in healthcare practices, and bring our Starfish professionals into those locations to help children get to the other side in a healthy way.
Yeah, and you mentioned, I've met several of them, but you mentioned Starfish professionals. I think the audience, listening audience, needs to know, how many of those do you have? It's a great group of people.
At Starfish, we have about 400 employees. We have
that's
a lot of
people
teachers,
helping.
Social workers, psychologists, administrators like me, and we're really trying to create a culture of skills and knowledge in our organization that you don't have to be a mental health professional to support the emotional well-being of the kids and the families that we work with.
Excellent. And so one of the things I like to do on this show, particularly when we have a topic like this, is I realize that there's not a lot of kids listening to this show, but there's a lot of grandparents and parents, guardians, adults. And based on what you see, what your 400 colleagues see, and any advice for parents who may be listening of how to find, if they think something's wrong, how to find Starfish, first of all, and then other resources that they might be able to, because a lot of people I've talked, they don't know what to do. So they end up ignoring things, not because they're bad parents or bad people, it's because they don't know what to do. So is there something you could help share?
Sure. And I'm gonna answer at a big picture level and then a more specific level. But and I'm plagiarizing from a colleague of mine at Starfish who I thought had a great analogy that when you get on a plane and they're telling you about the emergency evacuation procedures, they always tell you to put your oxygen mask on before you before you're putting the mask on your child who's sitting next to you. And I think as parents, whatever challenges we're facing, it could be our child has a mental health issue. It could be just I'm running late to work and I'm stressed out about that. Parents often feel defeated and depleted themselves, and they've got to take care of themselves first. And I encourage them to find organizations in their community. There are many of us out there doing this work. Find an organization like Starfish where they feel valued and they feel supported by other parents and professionals who want to help them work through, if it's a mental health challenge, if it's a housing challenge, an economic challenge. We are out there, and there should not be the stigma that we have in our country and our community around mental health challenges. No one is afraid to say they have a stomach ache, they have a headache, their eyes aren't working. And our emotional well-being really sets the stage for all of our physical well-being, and they go hand in hand. And I think Michigan has a lot to be proud of, and so does the Wayne County, Detroit area, of the mental health system that is here and in place. There's always things we need to do better, but there are access points through calling Starfish, through calling the Detroit Wayne Community Mental Health Authority. It's called the Authority now, and asking for help and getting a diagnosis and getting linked to professional services.
Great advice, and we're certainly proud of the work that you're doing at Starfish, and I know we have some mutual friends, and starting with Philip Fisher.
Yes, he's on our board.
Right.
He's a huge champion for families, kids, and for Starfish.
And the Fisher Foundation has also been a supporter of our foundation, and so
and ours as well.
I know, and if they're listening, so thank you very, very much. And one of the things I always say to people is kids can't vote, and so they need an advocate. And so I see a bright future for Starfish and our foundation together.
Yes.
Helping kids throughout the state, particularly in Wayne County in this case. So, Ann Kalass, thank you very much.
All right. Thank you, Larry.
That was great. Ann Kalass, Chief Executive Officer of Starfish Family Services. And next, we're going to speak with Lisa Nuszkowski from Downtown Detroit Partnership, and she's the founder and executive director of MoGo, if you've seen the red bikes around town. And it all happens next on Caring for Kids, here on the great voice of the Great Lakes. News Talk 760 WJR.
It's Caring for Kids with Larry Burns.
Okay, welcome back, everybody. Larry Burns here, and I'm joined again. Welcome back to Lisa Nuszkowski. She's the founder and executive director of MoGo, but she does a lot more for this great city of Detroit. And one of the things we wanted to talk to Lisa about this time is Open Streets Detroit.
Yes, so thanks. It's great to be back on just a few short months later.
Yes.
Yeah, so we are planning for our second annual Open Streets, which will be Sunday, October 1st from noon to 5. We're going to be temporarily closing down about 3.5 miles of Michigan Avenue and Verner Highway in downtown Corktown and southwest Detroit to cars, and opening up to people walking, biking, running, jogging, rollerblading, skateboarding, wheelchairing, essentially anything that doesn't involve a motor.
Oh, that's awesome.
Yeah, we're really excited. And along with that, we're going to have over 110 program partners providing a whole range of activities, everything from dance to sports to music to arts and culture, some educational, informational stuff as well. And so there's going to be a great density of people and activities. And so it's fun-free, family-friendly. So we encourage everybody to come on out and enjoy this wonderful last little bit of fall we're having here in Detroit.
Absolutely. And I believe it's the second year we're doing this, right? You're doing this.
Yeah, that's right. So we piloted Open Streets last year. We did 2 Sundays in a row. It was largely the same route, although we shrunk the route a little bit this year, and we're starting just south of Beacon Park so we can connect to that great new amenity here in the city that DTE launched earlier this summer. Right. So that's going to be one of our activity hubs at Beacon Park. And then we connect down to Michigan Avenue from First, and then it's Michigan out to Roosevelt Park, and then Verner from Roosevelt Park out to Military in southwest Detroit. And
what are some? Can you give us examples of what some of the program partners might be doing, and what kind of activities they'll bring?
Yeah, it's all ages. So we have, for example, one organization called Little Dumplings that does work with young children. So they're going to be doing some physical activity stuff with them. We've got some arts and crafts and painting activities that are aimed for kids of all ages. We've got a group that's doing parkour that's going to be coming down. So that's a really interesting sort of like dance along with the physical space in a place. And so they're going to be teaching that. We've got Ballet Folklorico from southwest Detroit, which is going to be performing traditional Mexican dances and also providing some lessons. We got the Motor City Street Dance Academy, who's going to be doing some breakdancing and lessons there. We've got Detroit City Football League, which is doing some soccer stuff as well. So everything from a small neighborhood-based group up to the larger organizations and in between. So it's a really nice range.
It's a little bit of everything for everybody.
Exactly.
Now we're going to be a partner, the foundation.
Yes, we're thrilled to have.
We're very excited about it.
Children's
You sent me an email,
Foundation.
and I said to my colleague Jill Nelson, "We got to do this. We got to help Lisa out." And so we're trying to. We're figuring out what we're going to do, but we have some good ideas, and so I'll tease the listeners and say, look for some presence of the Children's Hospital Michigan Foundation, and so it's free, right?
That's right, free. And the focus of the event is really on a couple of things. So one, it's about physical activity.
Okay.
So it's different than like a street fair or a festival, and that we really encourage programs and activities that encourage movement. So we want to get people out there and active, which is, I think, a really great partnership with the Children's Hospital of Michigan Foundation.
Yeah.
And then we also are really doing this to support the local businesses along the route. So oftentimes when you're driving by, places in a car, you might see something, but you're like, I don't want to bother to look for parking, et cetera. So this provides a nice opportunity to slow people down, check out those, shops and restaurants you've always wanted to go into, support our local businesses, and connect with the community.
And one of the other questions I had was that if it rains, we still go, right?
Yes, this is a rain or shine event.
Right.
We're putting out all the good vibes possible for great fall weather that day. But yes, if it rains, we'll still have the event. Now, if there's any sort of dangerous weather situation, we'll certainly communicate with people beforehand.
It's going to happen. The weather's going to be great.
Exactly. I'm putting that out there, too.
I have complete faith in you and that in the weather. So is there a website or anything that people, if they are listening in their car and they aren't writing things down?
Yeah, absolutely. So we encourage folks to go to www.openstreetsdet.org, O-R-G, and there's information about the route, a map, and then we'll have a list of all of our program partners and the activities we mentioned and where they will be located. And then we also have a frequently asked questions page as well, so it encourages people to think about bringing things like sunscreen, water, comfortable walking shoes, just things that will make the day more successful.
Will there be food available along the way?
So there'll be all the businesses.
Okay.
We've done door-to-door with every business along the route so that they know, so that their doors are open. They can take advantage of people being there as well.
Yeah. Most of my friends will want me to ask you, will there be like beer and stuff available?
So if a restaurant offers that, but you have to consume that within the restaurant.
Okay.
You can't be out walking around in the street. So
these are others.
Again, focus on physical activity, healthy activities.
Yeah, these friends
not that having a beer is not.
It's not bad. No, not on a Sunday. These are also CMU graduates, so
exactly.
These are my friends.
So partake in open streets during the afternoon, then stay for dinner afterwards and have a drink or two.
I will guide them.
Yeah.
And so before we let you go, how are things going with MoGo?
Things are going terrific. We've had a wonderful first year. We're approaching our 4-month anniversary. That'll be on the 23rd. And so we've been just really thrilled to have bikes out on the streets, see people riding them.
It's awesome. I see more and more every day. Yeah,
exactly. And I think it's, awakening a new awareness for people that there are other ways to get around Detroit. And so we just hope to keep building on that momentum. We're a 365 system, so we're not going away this fall or winter. So you can continue to ride throughout the year and look forward to keep growing our ridership.
Yep, our very own Mark Blackwell rides these bikes too. He likes it very much, he tells me. So Lisa, thank you. Appreciate it. We're excited to be involved with this new activity for us, Open Streets Detroit, Sunday, October 1st. So we hope everybody gets out there and joins the fun. So thanks a lot.
Thank you, my pleasure.
Thanks for all you do. That's Lisa Nuszkowski, founder and executive director of MoGo. I'm Larry Burns. I want to thank you for listening, and we'll see you next month.
Caring for Kids on WJR has been presented by the Children's Hospital of Michigan Foundation.